what still holds true is that our COVID-19 vaccines are the most effective and safe tool we have to prevent infection and harm.
Dr. Stephen Thacker says while they have developed new treatments for COVID in the last year, people who are not vaccinated are still 11 times more likely to die if they get infected with the virus. Thacker saying the Delta variant continues to affect younger people and making them sicker quicker. He says the average age of patients hospitalized is between 30 and 50, but they do have 3 pediatric patients here. He says they've recently treated more children with COVID here than ever before.
95+% of these children are of an age that they couldn't receive the vaccine. And so again, the only way the community protects them and prevents them from being harmed by this virus is choosing vaccination for themselves.
In terms of patients, he says up to 40 have been in the hospital for longer than 3 weeks.
When you really think about hospital resources, it's important to think about all the ongoing care that happens for individuals that thankfully have survived COVID-19 but have ongoing need for continued hospitalization that sometimes can last many, many weeks beyond that point. Thankfully, we've not reached a point where we have run out of oxygen to make available to our patients, but we've also had to manage it very tightly throughout this surge.
Thacker says up to 90% of doctors and nurses here are likely vaccinated, but the facility's overall rate is about 60%. And he's urging more people wherever they work to get the COVID vaccine.
The idea is to get as many as we can vaccinated because it creates an environment where it is much less likely that a new variant of COVID-19 takes hold and spreads throughout our community, as unfortunately this last one has.
Joanne Merrigan, WSAV News 3 on your side.